Hello again, everyone. The purpose of this screencast is to illustrate how you can generate numerous research questions and ultimately publish several papers from one study. And I put in quotes one study there because, as you'll see, using epidemiologic methods, you can do a lot of data collection at one point in time and then follow individuals into the future to collect additional data to look for associations between whatever the exposure event was and the disease or illness. So, as I mentioned previously, I like to do prospective cohort studies where I collect measures of physical function or physical performance. And I do that using functional tests. And for those of you who aren't familiar with functional tests are these gross body movements that can tell you things about power, balance, or agility. Now, of course, there are tests like an isokinetic test, things like that may help you to pinpoint strength of a particular muscle. But I have chosen these functional tests to explore because they're easy to perform. So if you can screen athletes with them, anybody, regardless of their educational background, could administer the tests. So think coaches, a quick screen to see if their athletes are at risk. Because ultimately, what are we wanting to find out? Well, if somebody is at risk for injury from doing a preseason test using a functional test, then maybe we can do specific training to reduce that risk of injury. So a little bit of background here. During 2017, I invited 6 teams to our motion capture lab at George Fox University. There were teams representing the D2 level, the NAIA level, and the Division III level. Also, I partnered with friends at Azusa Pacific, and they collected information about their volleyball team. They're at a D2 school also. And I had previously collected data from Fox volleyball players in 2015 and 2016. So approximately 130 some athletes participated in most of the preseason tests. So these were the tests. Diagnostic ultrasound. Why we did that is we wanted to look at the health of the tendons. Volleyball players, since they jump a lot, frequent jumping increases the risk of developing patellar tendinopathy. So we wanted to see what the tendons look like at baseline. The Y balance test, number 2 there, again, a test for lower extremity balance. The standing long jump and the single leg hop. So the standing long jump like a broad jump, single leg hop, a hop for distance. I had looked at those tests previously, and with a population of 82 volleyball players, I had found that there was a relationship between preseason performance on each of those tests and subsequent risk of injury. Also included the drop vertical jump from a 1 foot and a 2 foot box, and the lower extremity functional test. That is an agility drill test. So previously, this was a paper published in 2020, and you might be thinking, wow, 2020, but you were collecting that data back in 2017? Well, sometimes papers can be slow to get published. So what did I find? If we look down here, if we look at this here, if an individual had a standing long jump less than 80% of their height, both of their single leg hops were less than 70% of their height, and there was a single leg hop side to side asymmetry in hop distance greater than 10%, those individuals had a 4 times greater risk of any non-contact lower quadrant injury during the season, and a 6 times greater risk of a non-contact ankle or foot injury. Now, my primary question was, can those preseason functional performance tests, and again, the diagnostic ultrasound wasn't a functional performance test, but it was another test that we did, can these functional performance tests discriminate injury risk in a cohort of female collegiate level volleyball players? So this was a prospective cohort study. We'll talk about different study designs in coming weeks. Perspective, again, something that's planned and you're looking into the future. The primary statistic we utilize is the relative risk, or known by its other name, the risk ratio. Now, as a kind of side question, again, looking at my main study, the functional tests, another question I was able to generate, is an athlete at greater risk for jumper's knee, which is the patellar tendinopathy, based on the sonographic evidence of patellar tendon abnormality? And so what you can see on an ultrasound image is if there are these darkened areas, these hypoechoic areas, which are suggestive of an abnormal tissue response to loading, so a failed healing response. So our first paper that we got published was the diagnostic ultrasound paper, and what we were doing is we were looking at the prevalence, so the percentage of people at that point in time that we tested them, the prevalence of individuals with that patellar tendon abnormality. We were also able to report that there was no association between patellar tendon abnormality and an increased risk of symptomatic jumper's knee. Why is that important? Well, a previous study had suggested that you can use the images and identify people who may be at a greater risk of developing patellar tendinopathy. That particular study was a study that looked at high school aged basketball players. So statistically, the prevalence or percentages was used to address the number of people that had patellar tendon abnormality, which was, I think, around 20%, and the incidence, number 2, again, we use the relative risk, also known as the risk ratio. Next question. Can preseason Y balance performance discriminate injury risk? So this is part of the kind of main question, that overall main question. And a paper, a study that was done by Dr. Phil Plisky, one of the early graduates from Rocky Mountain University, he initially looked at the STAR excursion balance test. And with the STAR excursion balance test, that's where you lay down 4 long strips of tape on the ground, and they are oriented 90-degree angles, the first 2, and then you create another set of, so one is going to be a plus mark and then overlaying it an X mark. From his study, he found that people who had poorer scores in this Y shape were at greater risk, and it led to the innovation of the Y balance, which you see there pictured. So I was able to get 2 papers just by looking at the Y balance test. The first one was a paper looking at descriptive measures. So I was able to write something up looking at what the mean scores were based upon competition level, player position, and starter status. And then the subsequent paper we published was one that looked at the risk of injury based upon Y balance scores, and there was no association or no risk. Next up, can preseason reactive strength index scores discriminate injury risk? Well, what's reactive strength? Reactive strength is a measure used a lot in the strength training world or the strength and conditioning world, and it's a measurement of how high somebody can jump in relation to how long or contact time on the ground. So you want to have less contact time and a higher jump, and that's going to then give you that reactive strength. So, paper number 4, published in the Journal of Science and Medicine and Sport. What we were able to do is utilizing statistical methods, identify a cutoff score, and found that individuals with a, in this case, 0.9126 time, right? So those individuals that had a 0.9126 meters per second, that is our reference group. A higher score is a score that we would say is better. The individual is more explosive. And so maybe we are then suggesting that to achieve that level of sport ability or functional ability, you might have to train more. So a lower score, a 0.9125 meters per second or less, that was our at-risk group. So individuals who perform the drop vertical jump at the 1 foot box height, those individuals were 4 times more likely to experience a non-contact lower quadrant injury during the season. Now, if we take a look here, the 2 foot box height, we didn't get anything at statistical significance at 0.05. The reason, though, is if we look at the numbers, and I explain this in the article, we didn't add this particular 2 foot box into the study until 2017. So I had collected the data in 2015 and 2016, as well as 2017 for the 1 foot box, but tried the 2 foot box out in 2017. But one thing we notice here is we're seeing a similar relationship. We just had too small of a sample size. See that relationship there again, where at the 2 foot box height, 11 people got injured in the at-risk group, whereas only 2 people were injured in the reference group. I speculate that if we had more numbers, another 20 in each group or so, we would have been statistically significant that you could use a 2 foot box also to screen athletes. Now, the strength and conditioning professionals talk about reactive strength being a valuable thing to train or to develop. And so I've got all this data now. Can I do some correlation study to look and see if reactive strength correlates with game performance? And that's what we did here, published in the Journal of Athletic Enhancement. And very simple study to do. Now we're just looking at the correlations between jump height and available stats. And we see some of the stats there, kills per set, assists per set, and so forth. And so what this is illustrating is outside hitters, depending upon what particular measure we were looking at, had correlations that were low to moderate and statistically significant. So it's suggesting that there is that low to moderate correlation. So it's a component of one's success in sport. Paper number 6 was a validation or looking to validate my previous paper. So remember this one here where we talked about having poor performance on the standing leg, the standing long jump, the single leg hop, and that asymmetry in the single leg hop. Well, these types of studies need to be validated because one thing that I've found in this area is sometimes people will report an initial association and everybody gets excited about it and says, okay, that's the next big test we need to do. And then we need to then find athletes who do bad and train them and no injuries will ever occur. Well, what happens a lot of times is when there are follow-up validation studies, there is not a similar finding. Or there's no finding at all, no association. So what do we see here? We did the same thing looking at standing long jump, single leg hop, and also trying to look at asymmetries. This again is that data from the 2020 paper, the first 82 volleyball players I ever worked with. Remember, the statistically significant findings were 4 to 6 times greater risk for all injuries or for foot and ankle injuries. Well, we published in Physical Therapy and Sport, and what we found is standing long jump, a lower right single leg hop, a lower left single leg hop, so that's the standing long jump below 80%, the hops below 70%, and not a asymmetry in distance, but prior injury history. So each of these things alone were not associated with a greater risk of injury, but if an athlete had a particular profile, and in this case, of the 130 athletes that we looked at, 28 fit that risk profile, having the lower jump and hop scores and a prior injury history, those individuals were at a 3 times greater risk of injury. Now, does this study validate these findings? Well, on one hand, you could say they're really similar, that maybe athletes that have lower standing long jump and single leg hop scores, maybe those are volleyball players that should get some attention by the strength and conditioning professional and try to address that. But it's not a perfect validation because it was a different finding here. This was a 10% asymmetry, whereas here, instead of the asymmetry, it was individuals that had prior injury history. Paper number 7, are there correlations between preseason functional performance test and game performance? And we published this one in the International Journal of Sports Physical Therapy. And, I won't go through all of them, but, it is a reference paper for people to be able to see if there's different correlations and get them thinking about, hey, maybe these are areas that we would want to train for athletes. And then finally, this was paper number 8, and this paper not only included data from volleyball players, but also included data from soccer, female soccer players, and female basketball players. And so I had a population of like 330 some in it. So it was a collection of data over many, many years. And what was really cool about it is from everybody, I asked them their prior injury history. And so what I was able to report in this paper is that athletes, female collegiate level athletes who had a prior history of an anterior cruciate ligament reconstruction, those athletes were at a greater risk of having a subsequent ACL injury in college. So really kind of cool. Again, not a main purpose of any of my studies, but because of the data that I had collected, I was able to publish another paper in the Journal of Science and Medicine in Sport. So hopefully what you take away from this is that with one particular idea you might have, if you kind of think about it, like what are the different things you can collect data-wise, you may be able to answer multiple questions, and you may be able to then generate multiple papers.